Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, Alcohol's Hidden Impact on Hearts. And trust me, it's juicier than your cousin's peach cobbler. Here's something that'll blow your mind faster than a Memphis thunderstorm. Did you know that one glass of wine might actually protect your heart, but 3 glasses could be slowly destroying it? Yep, entirely true. I can't make this stuff up. We're talking about one of the most confusing relationships in all of cardiology, the bizarre love-hate affair between alcohol and your ticker. Now, let me paint you a picture that's clearer than my grandmother's sweet tea recipe, light to moderate drinking, and we're talking 1 drink for women, 2 for men daily, might actually bump up your HDL cholesterol. That's the good stuff, folks, the cleanup crew of your arteries. Red wine especially gets all the glory because it's packed with resveratrol, this fancy antioxidant that acts like a bodyguard for your blood vessels. But here's where it gets trickier than parallel parking a pickup truck. The line between helpful and harmful is thinner than hospital coffee. I've seen too many patients who thought they were doing their hearts a favor, only to find out they were actually playing Russian roulette with their cardiovascular system. Even slight overconsumption can flip these benefits faster than a Sunday pancake. When alcohol becomes your heart's worst enemy, things get ugly real quick. Heavy drinking doesn't just give you a headache, it jacks up your blood pressure like a hydraulic lift and sends your triglycerides through the roof. We're talking serious business here, cardiomyopathy, where your heart muscle gets weaker than day-old biscuits. And don't even get me started on atrial fibrillation. That's when your heart starts beating with all the rhythm of a broken washing machine. If you're experiencing irregular heartbeats after your evening cocktails, maybe I should see you in the clinic. We need to talk. Plus, let's be honest about those empty calories. Alcohol is basically liquid candy that your liver has to process while your waistline expands and your diabetes risk climbs higher than gas prices. Let me tell you about Sarah, a 45-year-old professional who came to see me last year. Sharp as a tack, successful career, but she had this little habit of unwinding with 2 to 3 glasses of wine every single night. She thought she was being sophisticated, maybe even heart-healthy. Sarah's blood pressure started at a beautiful 120/80, textbook perfect. But after 6 months of her nightly wine ritual, that pressure shot up to 145/95 faster than a bottle rocket on the 4th of July. When I connected the dots between her evening wine habit and her climbing blood pressure, she looked at me like I'd just told her Santa Claus wasn't real. But here's the beautiful part of this story. Within 8 weeks of cutting back to just 4 drinks per week, her blood pressure dropped right back to normal. No medications, no fancy procedures, just good old-fashioned moderation. Now, I'm not here to be the fun police or tell you to swear off alcohol like it's kryptonite, but I am here to give you the straight talk your heart deserves. If you're sitting there thinking about your own drinking habits, wondering if you're walking that tightrope between helpful and harmful, here's what I want you to do right now. Pull out that phone of yours and open up your Note app. For the next week, track every single alcoholic drink you consume, every beer, every glass of wine, every cocktail. Write it down like you're keeping a diary. Be honest with yourself because your heart sure isn't going to lie to you. If you discover you're exceeding 7 drinks weekly as a woman or 14 as a man, I want you to cut that number in half starting tomorrow. Not next Monday, not after the holidays, tomorrow. Your heart will thank you faster than you can say sweet tea, and your blood pressure might just surprise you. The bottom line is this: alcohol and your heart have a complicated relationship that would make a soap opera jealous. A little might help, but too much will definitely hurt. The key is knowing where that line is and having the wisdom to stay on the right side of it. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.